All right, we're going to go through a series of exercises that have been known as the Thrower's 10. There are multiple variations of it that you'll find on the internet. The original writer was Kevin Wilk, and even he's created other clusters over time, and you can find videos of Kevin Wilk's work on the internet. And all of his are done with a TheraBand, so we're going to demonstrate Thrower's 10 with dumbbells. So the first thing we're going to do is we're going to work on your rotator cuff, as that's a precursor to setting up your shoulder for other activities. So inside lying with a towel underneath your arm, so you don't have to worry about a wringing out phenomenon at all. I want you to set your scapula and kind of squeeze that towel a little bit. That'll inhibit deltoid. And you're going to do external rotation, up and back down. And our goal here is to work for high volume. And again, have your athlete or your patient work at a slow enough speed that it's concentric, up, 1, 2, 3, down, 1, 2, 3, 4. So you're really getting them to recruit and isolate the external rotators. So again, I'd have Ben do high volume. I can dose this appropriately. Typically, you're looking for 3 sets of 20 to 25 reps for the throwing athlete. So now, internal rotation on a table is a little bit difficult. For some patients, lying on their shoulders not comfortable, so you might end up having to do this in standing with the TheraBand. But this would be an example of internal rotation, concentric, eccentric contraction for subscap and other internal rotators. Most people can also tolerate a heavier dumbbell for this motion than you can for your external rotators. So now we're going to do some what's called I's, T's, and Y's. And a lot of times people will cluster this as one exercise. So if I have Ben put his arms up at his hips, if he lifts up here, that's an I. Okay, if he comes back down and goes out to the side, he can do a T. Now coming back down, I want to get you truly at 90 degrees of abduction on a T, and then squeeze your scapula, and now lift your arms up to horizontal. There you go. Okay, and then for lower trap, we'll do the Y, and he's going to lift up in here to get lower trap. So that's the I, T, and a Y. Okay, so now we'll come back to your I, and there's a lot of debate about how to position this. So if he's in full pronation or his palms up, he's going to work through here. Okay, I'll go back down. Now put your forearm to neutral and lift. Okay. Now rotate into full supination at your, okay, and now squeeze. And you feel more torque in this position. Mm-hmm. So this position also has a lot to do, relax, with scapular stability and getting people to recruit lower trap and rhomboid. So it's analogous to that pivot prone position. So your arms are externally rotated when you squeeze. You're going to put things into a kind of a shortened position and really ask muscles to work in a kind of at a disadvantage and get some strengthening in a range you don't typically do. So many times when I teach Throwers 10, I teach people to do this with palms down. So I want to squeeze here and then lift. That's the I. Okay, bring it down, go out to the side, do your T, squeeze, lift, there you go, back down, and come up into your Y position and lift. Okay, and back down. And now in this position, the limiting factor to this exercise is how strong he is in the Y position. This is by and large the hardest position to do. So if you might have to have patients break this in, and they're maybe doing a heavier dumbbell in these other positions and a lighter dumbbell with the lower trap portion. Okay, so that's I's, T's, and Y's. You can cluster them, have people repeat the sequence. So if we take you back here into an I, so we're going to go up, 1, 2, 3, down, horizontal, up, 1, 2, 3, and down, and then your Y, and lift, hold, 2, 3, and down. Okay, that counts as 1. So you have to do all 3 positions, and that's 1 rep. So then you could repeat this sequence. If you had a patient that really only wanted to work 1 arm, for whatever reason, 2 arms is nice because you get crosstalk between the scapula. So slide over a little bit, Ben. Let your arm just hang out to the side. Give yourself a good neck position. All right, now do your I's, T's, and Y's with one arm. There's your I, back down. T's. On his T, his thumb is always up, okay? And back down. And then now your Y. And the nice thing about doing it off the edge is now he's going to work his arm through full range of motion. When you're off the table in the middle, you're really asking the patient to start firing from late in the range, and it's a lot harder. Here he has a chance to recruit the entire range of motion of the lower trowel. So in many cases, this is an easier starting point for people. And again, they might have to ditch the weight on the overhead one and have a heavier weight at the lower two positions. Okay, so those are some options for I's, T's, and Y's. Okay, and now he's going to do isolated external rotation from an abducted position. Notice he's recruiting here, so his glenohumeral joint's in a good position. Just relax this side. If I just let him lift here and he just flips his arm up, he could anteriorly sublux. So I want his scapula recruited so that his humerus stays in the socket while he's doing this exercise. So recruit your scapula, set it, now do your external rotation. And it's a little bit better pure spin in the joint than letting him slop and letting his shoulder come forward as he externally rotates. So that's horizontal adduction with external rotation. So this is getting a little bit more lower trap work again, but it's external rotation into a cocking phase. So if you have an overhead athlete who's coming back like this, like for tennis, or a javelin thrower, or a cocking motion if somebody has a higher cocking motion, this will help you work posterior stabilizers. These muscles are super important to eccentric control on the release phase of throwing or the follow-through phase of a racket sport. All right, so that's an overhead row. Now what Ben's going to do is a rowing action, keeping his elbow close to his side. So this is a true row. This is all for scapular retractors. So getting rhomboids, middle trap. Lower trap's working a little bit as well. Make sure their upper trap stays silent in this. If I had his shirt off, I'd be watching to see, make sure he's not hiking his shoulder at all. Okay. So this is an agonist reversal for scapular stabilizers. This is going to be a 3 motion activity. It's going to count as 1 again. So we're going to lift up. 1, 2, 3, 2. 1, 2, 3, 3. And then you repeat that sequence going for high volume. So things I'm paying attention to are is make sure he's got a good stable base. He's not throwing his back into extension as he's doing this. If you want, you can have an athlete get into a more athletic posture. So I'm going to just have you do like a little mini squat, really keep your core on, and now do it in that position. So that's going to be a little bit more dynamic exercise, get him working on some core stabilization while he's doing stuff, and I'll make you slow down. There you go. Things I'm watching for is shoulder hiking. So if he starts getting tired and starts elevating with scap, there's your scaption, and then out to the side. It's a long lever, so for a lot of people, they just need a light weight. A lot of rotator cuff work is done with really light weights because you're working high volume for endurance of the rotator cuff and the scapular stabilizers. So I'll give you a nice weight. Again, get yourself in a nice athletic posture, and you're going to do full range of motion for your biceps. Biceps is basically the 5th rotator cuff muscle in terms of a stabilizer. It is also important for eccentric control. So you want any type of overhead athlete to have a strong biceps to help as an accessory stabilizer. Okay, now we'll switch this to a triceps overhead. And if you want to bring your other arm in for stabilization, that's fine. We're going to work on a straight overhead triceps work. Again, you have to work with your athlete to find out what weight is appropriate for each of these activities. So it takes some time to really figure out a good throwing program, because he might be doing bicep curl with a 20, 25 pound weight, but doing something else at his rotator cuff with a 2 pound weight. So you get a lot of athletes that don't like those pink weights, but sometimes that's okay. Okay? So that'll give you biceps and triceps. Now we need to work your forearm a little bit, because you're thinking about throwing athletes need to have grip strength. So I want to make sure that I have him in an upright position. I hate to see people sitting like this doing wrist exercises. So get him upright, get him upright, and let's have you go through full wrist extension and then drop down. Now, what's nice is you can work all of your flexors. So when you let that weight drop down, I want to let it roll to the end of your fingertips, and then grab it and roll up as you come up. Okay? And then let it kind of roll down, and then work through the range. What that does is allows them to get more wrist motion, because it allows your fingers to open up a little bit, so you can work on full range at the wrist joint. Okay? Then you can flip your arm over and do curl. Get a little better shoulder posture. You're welcome.
Thank you.
Okay? And then he's going to let his fingers roll down and grip up, and then do full flexion curl. And again, this stuff could be done with a TheraBand as well. And Throwers 10 online is with Kevin Wilk is all with TheraBand. You can also work pronation and supination. So if you grab your weight like this, you can work on pronation, supination. So there is pronation, and then concentric pronation, eccentric supination, concentric pronation, eccentric supination. So you have to think about where you are in relationship to vertical. So there you're switching your contraction. You have to pull up against gravity, then control against gravity. So anything will work. If you have an athlete that's a baseball player, they can take a baseball bat, put the weight on it, and use that as a resistance tool. I've taken racket sports, take a tennis player, take their racket, tie a TheraBand to it. And they can use that as a weighted tool. That also gives them a functional grip. Okay. I'm going to have you do a couple closed chain activities as well with Throwers 10, just because it helps with stabilization. So this next one, I'm going to have you sit up here on the edge. What you're going to do is you're going to be working on a dip. So this is really just scapular depression. So what I want you to do is just lift your rear end off the table and work on scapular stabilizers, and then back down. And really depress your shoulder each time. Good. So that's a closed chain activity for shoulder girdle. Other closed chain activities would include any type of push-up, wall push-up, modified push-ups. And most athletes who are overhead athletes have plenty of mobility, so they need a closed chain exercise to give them some stability as well. So working on the dip is important for scapular stability, and then doing a regular push-up. So in this case, we'll just put you on the wall. So now he's letting the scapula come into full retraction, push, and then the plus, make sure he works the serratus anterior to get the protraction at the end of the range. So there's your push-up with the plus. And there's all kinds of variations of closed chain activities that can be done to help with scapular stability as well. So that's kind of a well-rounded Throwers 10, give or take 5 variations of exercises that can be done for the overhead athlete. Following all this strengthening, he needs to do a good stretching program, particularly a sleeper stretch to stretch out the posterior side of the shoulder after all of that work. And we may also be doing some manual stretching of an athlete after that activity as well.